All right. Hello, everyone. I forgot to mention I'm a certified aging services professional, CASP, and I got that through the University of North Texas in Dallas. Let's begin the topic. A person-centered care, a person-centered culture. We called it culture change back in 2012, 2008, actually, when we started looking into what does this mean? What are they talking about person-centered? And here where I work at Manor Park, I recently did growing the person first culture throughout our organization. So I did a presentation to our lead folks in order to get them, back in tune because with the COVID-19 pandemic, we do lose a lot of headway that we had gained. And that institutional creep started coming back in, as you all can imagine and attest to, that does happen when you have to quarantine residents into their rooms. So, Person First is just a set of principles and skills taught as part of the firebranding process for building culture. And one of the things we talked about was building culture isn't just about training or learning. It is an opportunity that must involve a range of opportunities to do together, listen to one another, and decide and take action together. And when we talk about supportive workforce, that is what you're truly trying to accomplish. And so today I'm going to share with you a little bit about the National Center on Advancing Person-Centered Practices and Systems. So what I did was I Googled and looked up what is HHSC doing, and this is what popped up, the National Center on Advancing Person-Centered Practices and Systems. And I thought it would be a good way for folks to have a variety of options to look at in order to create that supportive workforce that is centered around person relationships. Participants will also hear about how to become a person-centered organization from Support Development Associates, and I have these in the reference page. You'll learn about personal transformation, leadership transformation, organizational change, and environmental changes needed for person-centered care. And then we'll discover how this ties in to creating a better workplace environment. Next slide. Jesse. Oh, okay. So the resources that are available through this website is 5 competency domains for staff who facilitate person-centered training. I mentioned that we used Action Pact Incorporated in order to create our culture change, and they taught and had 25 facilitators. That has gone down to about 13 of us persons here at Manor Park that are who can facilitate person-centered planning and training. This website also offers person-centered practices self-assessment for you to be able to look at some questions and take an assessment. Where are we now? And then how to engage others, how to engage the staff, how to engage volunteers, how to engage family members and residents in best practices. And it also has an asset mapping toolkit, which would be very helpful. And I'll go over a scenario which we did that will help show what we're talking about when we're talking about asset mapping. And then healthcare person-centered profile is how to look at what a resident does and what perhaps an employee does and how they live their life and how you can incorporate that into the daily life in what used to be an institutional setting is now a home-like setting. Next slide. So again, this is that website for the National Center on Advancing Person-Centered Practices and Systems. And again, their tagline is transforming how we think, plan, and practice. And when you talk about culture change, that is what you're doing. It must involve a range of opportunities for staff to do together, for residents to do together, listen to one another, and decide and take action together. Next slide. So, person-centered planning requires more than training. Good training results in competence. So if you're having to train your nurses on how to put an IV in, and so you're training them how to do this, you need good training so that that nurse feels competent to put the IV in. Routine use of what is learned requires perceived relevance and support. So that nurse that's doing the IV needs to see that it is relevant, that she does this for that dehydrated person, and then she needs the support of other options and opportunities in order to make that a successful thing that she's doing. And so, again, it goes back into doing together. So next slide will show an example of that. It is a change in thinking and a change in practice. So fixing something versus supporting something. When you have a culture that the leaders feel like they have power over, the character you see here is what a lot of your employees may feel, as well as your residents. If they're told when to get up, when to be ready for breakfast, they may start to feel like they have this demeanor of not feeling much in power. But if you look at the other side, working together, and again, it just goes to show that if we support one another in our actions and our decisions, it will make you feel more a part of the culture. Next slide. So one of the things that was presented in our program of Action Packs delivery system, change takes a long time. And so we started the change and were able to have them for 12 months. Each month they would come in and do a session with these 25 members of the team that I shared with you, and then they were to disseminate the information to each of the neighborhoods of the households. So what we found was personal transformation. The irritant is experienced, and then I introduce the question. So what we're going to look at as an example is breakfast. So when I came to work here in 2011, the 10 to 6 shift was actually getting up all of the residents, all 20 residents on one of the neighborhoods, having them up, dressed at the table for the 6 to 2 shift that came in. So that early morning shift walked in and saw all the residents were up and at the table. There would be discontent if residents were still in the bed and not up. So that is a not a person-centered culture. That is a staff convenience culture. And you probably do see that somewhat. So you introduce the question to the staff that are working. What does it look like if we do breakfast different? What does it look like if we let residents sleep until 9 o'clock? What is their preference of when they want to go to wake up? My mom is a perfect example. She always woke up late, and I monitored her after her hospital stay with COVID-19 in my home, watching her rest and sleep, and she would get her best sleep from 4 till 8. 4 in the morning till 8 was when she really did some really good sleeping. So just think about that. She gets some really good sleep starting at 4, and we're in at 5 to get her up to be at breakfast table at 6 or 7. That would not make for a happy Nancy, which is my mother's name. So we provoke the system, and we start asking the question, do we want, and so the debate begins, do we want a home or do we want institutionalized hallways? Next slide. So you've gone through that personal transformation of starting to think. You've got to have leadership that is going to transform. They have to embrace what's going on. The internal voice awakens, and then that quest begins, and there will be chaos. And it's amazing when I look back on our journey, that chaos was there, evident, and a lot of it was because some of the staff did not want to change. They weren't. This is the way we've always done it. Why are we doing this? We tried this 2 years ago, and it didn't work. That kind of talk. So encouraging staff to embrace and giving them knowledge that there will be chaos. Get ready because it's coming. And then you align that vision and the resources begin. So when we're talking about breakfast, when we're all on the same page, you can go to the next slide. When we are all on the same page, that's where you see, how do we make it work? Well, we can buy toasters, we can buy a hot skillet, and we can start doing omelets. So that was one of the first things we did, was we had omelets that would be served to 7 to 10:30. Now it's a 7 to 11:30. But at that time, you can start little and then go big. So the epiphany results in moral clarity. I had a nurse, she was an RN, she had worked here for 12 years at that time, and now she's worked 22 years. She was one of those that was resistant, was kind of like, yeah, here we go again. This is the way it's going to be. I'll stay along with them, but I really don't believe in it. But once she did start believing, it flowed over to other people. And so at that point, she started saying, well, we must do this. We can't go back. How do we do it? And that develops into this climactic phase, which you start to engage partners in design. And what does that mean? What we did was we had a hub for the nurses station, and then later we had just another room that had 4 nurses in it, and the social worker and activities that were all over there in that one room. Well, when we started this process, we said, let's move the nurse to the neighborhood. What does that look like? And so we had to engage partners in design. And what we decided, because we didn't have money to do this, is we went down and we had enough money to purchase some plants, some taller plants, and put them on the floor, so it was making a division. So it helped us to divide so that the nurse could have her space, moved a desk over there, got her a little, what you would call a cubby hole, but it worked because now she was in the living room with the residents and could see the dining room. She wasn't in another room. So that concludes organizational change. And of course, as you do this type of thing, you may decide that you want to build a new cottage. And one thing I can say about that is the new cottage, the brand new, cooking on site, really makes a huge difference. But there are some things that you can do that will continue to provide that journey to culture change and person-centered engagement. So the environmental change does happen, whether it's in those little increments or it's in big, we're moving to a new place. But when you speak out and you commit to resolve the issues, whether it is breakfast, rising in the morning, we implement the change and you will see energized chaos. And that energized chaos is something, again, when you start making a neighborhood coordinator or a household coordinator, we tried what Action Pact had told us to do. It would be someone like the social worker or the activities director. But we found that it was the lead CNA. So we had a CNA then that was promoted to become the neighborhood coordinator. And if you think of each neighborhood like a small nursing home in itself, then that lead CNA, neighborhood coordinator, becomes the administrator. And that lead LVN or the ADON becomes the clinical leader. And so the clinical leader is acting like the DON for that group of 20, and it makes a world of difference. Next slide. So supportive workforce, how does this all tie in to what we're talking about? What we learned early on once we were starting to do person first training, which is an 8-hour training, hands-on, interactive, go out and do a scavenger hunt on some of the tools that you've learned. We eventually learned that this program had been designed for dementia residents. And so it's very effective to knowing what to do and how to communicate with someone who has dementia. What skills do they still have left, and how can you use those skills to make life better? We started feeling like, and it was told to us, that this is also good for just a person. It's called Person First. It's not dementia person first, it's person first. And we started applying that to our employees. So the next slide. What are 5 valued experiences that a person has? You have personal relationships, and we started calling person-centered care relationship-based care because we found out the more we knew about the resident, the more we knew about their lifestyle, their preferences, and their things that they enjoyed to do, the more that relationship built around the average daily life in the community. Yes, there were structured activities. Yes, there were spontaneous activities. But when you start looking at a person that loves to get up and have a cup of coffee with a piece of toast in their room before they have breakfast and watch the news, that's an activity in itself. All of life is an activity of doing and being. And so then when we started to apply these principles that we were learning in Person First to our staff, it became more and more clear that we have to listen. They're sharing the same place. They're doing the same activities. You know, everyone is an activity director, but you know, you still have the clinical person, you still have the social worker, you still have tasks to do. In these cottages that I referred to that we had built, the laundry is done there, the housekeeping is done there. All of the folks that work in these areas are CNAs. And so we had housekeepers that worked in our housekeeping department that now became CNAs. And that was one of the reasons I became a CNA in 2012 was because we wanted it from top down, leadership. So me and the Stephen Nelson, Robin Boyd, the activity director, the social workers, we all became certified nurses aides so that we could work alongside and be, you know, the person that came in maybe on a tour and it was be like, that's not my job. I got to go get the CNA. We could do some of those tasks right there with our staff. The employee needs to feel like they're contributing and that they are making choices just like the residents do, and being treated with respect and being valued. All of these things are what we teach for person-centered care for dementia residents, which then went on to be person-centered care, relationship-based care for our independent living residents, our assisted living residents, and of course those with memory, cognitive issues in assisted living. But everyone wants to be treated with respect, feel like their voice is being heard, and feel like they're being valued. Next slide. So person-centered care applies to employees too. Person-centered planning is part celebration and part exploration. And what this means is we were always told you need to celebrate the small wins. When you had a win, when you were setting up how we're going to do breakfast, then you needed to celebrate those times when you had opportunities to celebrate. Step back and say, look what we've done. The other part of that is exploring how are we going to get it done. And I'll talk to you in a little bit about steering teams and action teams. A way of learning and describing, knowing who the resident is, knowing who the employee is. How many children are still going to school? There was an instance where a lady had no other choice, but she was going to have to be late to work. We interviewed her. The team really liked her. We even had peer interviews, and we even included the resident. And then the residents, we had times when we have staff that come on as PRN and work in that neighborhood 8 hours a day to fill that slot, only to be told you didn't meet the criteria, or to be told the team and the residents really want you to be here. Now we're going to take you on full time. But what that takes is knowing the person. And this young lady that had young children at home and had to be coming in late, the team met and they said, you know what, we're going to allow her to come in by 8:14 every day. So that is her set time. And she's going to stay till 3:14. Or let me think, 6, 7, 8. She would stay till 5:14, 4:14. And so giving flexibility is crucial, and this worked for that household. How the person wants to live and or work. So, asking your employees, we know how the residents want to live. How do you want to work? What feels good to you? Well, I would prefer to do the laundry and then get back to doing CNA work. Or I would like to cook. So we have cooks. Our cooks are certified nurses aides. So just an interesting concept of how to include your staff into feeling like they're heard, feeling like they have choice, feeling like they're part of the solution in order to create that self-led team that really makes for a great working environment. Next slide. Okay, action teams create that synergy that we're talking about, disseminating the information to others. So we had a bathing action team, we had a care plan action team, communication high involvement team, which was an interesting team that I was on. um, and that was to take our journey and look at our journey and say, how are we getting the message out? How are we marketing what we're doing? And how are we keeping people highly involved after they go through person-centered training? So we had a person-first detective. And so we got members of the staff that were then acknowledged detectives. And so they would go around and say, hey, you are doing it right. Hey, I saw that in person first. And they would put their name in a bucket. So it was a lot of opportunity to praise for good behavior. And then we had a drawing at the end of every month to give something away. So then again, that was a part of high involvement's team effort. And on the high involvement team, we had someone from laundry staff, someone from our marketing team, someone that was a CNA, and someone from a different neighborhood that was a nurse. These 5 to 7 people would get together and study, explore, and then come up with ways that they were going to. And we had commissioning statements that were put together by these teams, and of course, when they would meet. Consistent assignment team help us to get rid of agency. Daily pleasures action team was that effort to find out what each of the residents wanted to do. What were their daily pleasures in life? Was it walking the dog? Was it going out and sitting outside in the sun? What were their daily pleasures that they enjoyed doing, which really helped with the care planning team. Dining services action team, employee recruitment and retention action team. One of the other sessions that I gave was the Get 'em, Keep 'em, Grow 'em, the Get It team that we had. And next slide has a few other action teams. The gracious dining team. How do we make dining gracious? Host and hostess action team was a sub-team that developed out of the gracious dining team. Household versatile worker training action team. Job title, we changed all our job titles to be more person-centered. And then laundry and housekeeping service action team, medication management, and then that organizational redesign action team. Next slide. Social services had an action team, and here you see our telling the story action team. And that was comprised of folks that would then go to each neighborhood and say, tell us your story. What is your journey? What is a story that can come out of it? What is a benefit that the resident had seen? And then we could write a story about it and highlight it in our huddles. Transportation and vehicle fleet team, waking and sleeping action team. So those are just a few of the 19 action teams that at one point we had going, and not all of them were at the same time. And they would have lives, so the action team would be like for a year, or it would be 8 months. Champions of Care was the training that we did for supervisors. So these newly commissioned neighborhood coordinators and household coordinators working with the newly appointed clinical leaders would take this and study it. And this was a little more by design. They had modules that we received. And then there were some modules that we developed ourselves. But it was, for the staff. What are your daily pleasures? Leadership capabilities or desire for it. To learn from your team who wants to advance, who wants to become an LVN, who wants to become a social worker, who wants to become an activities director or some other field, so you know your team a little better. This also went over the concept of learning circles, critical thinking, communication skills, managing conflict, and managing conflict, a practice where we would do um, skits to show how we do and manage conflict in our neighborhood. Meetings, consensus, how to build consensus, beauty and order, the elegance of everyday life, which goes hand in hand with Caleb's basket down at the bottom, which kind of explains that you can have small pieces of sand, big pebbles, smaller pebbles. The big pebbles may be grandson's birthday. Big pebbles may be a marriage of a grandson or granddaughter. So those are big events. What are those big events in the lives of those residents that we need to put on the calendar? You know, birthdays. And then what are the smaller things that just may be spontaneous? Going to look at the birds, helping to clean the table or set the table. So those are different activities that would go into that. But what is the elegance of everyday life? And I would always communicate, if you were in the resident's home and you were going to their home and you were going to be working in their home, what would you do to make life calmer, easier? You're cooking the meals, you're getting the resident up, you're going outside with the resident, so how can you make it feel like it's at their home and like they're not at our institution? So, next slide, please. Practicing daily life in the MockUp Room. Accountability. So we would do a session on working within the framework of laws, regulations, financial constraints. Our CFO really liked that one. Quality management, giving and receiving feedback, helping them learn to do the team evaluation, using our health record, and then feeding assistant certification training. So again, these are some of our champion of care modules. Next slide. A few others. In the food safety dining experience and incorporating residents into the work, be careful how you do that one, but there is opportunity. Documentation and washing dishes. Next slide. So some of the key points that we've covered today was a little bit on the National Center of Advancing Person-Centered Practices. It's a great place to start your journey and look at things that they offer in order for you to do that assessment. And then we talked about how you transform at a personal, individual level, which has to happen, and then how the leadership must transform before you can start that organizational change and environmental change. And then a supportive workforce must have a voice and then allowed to be part of the solution. Self-led teams don't happen. You have to have a plan. So I hope this was helpful to you all. Next slide. Is there a next slide? I think it may be the references. Yeah. So here are some of the references that I use for you to be able to locate when they do send out the email. After this presentation, you'll all get an email that will have some of the information in it.